You're looking after some of the sickest patients in the hospital, so it's emotionally, it's quite charged.
Sometimes we get emergency admissions from A&E or theatre. You know, they can come in very unwell and it's all hands on deck.
You know that this patient's life can be in your hand. So it's very challenging to make sure you're doing everything that you're supposed to do.
You have to critically think and critically analyse exactly what you need to be doing and when.
In critical care, we can focus on holistic care, so it gives me a sense of fulfillment. I've been a general ward nurse before in the Philippines, and I was a bit frustrated not being able to give my full 100% to the patients because I have to handle a lot of patients at the same time.
So you're looking after the patient from head to toe. You're looking after their breathing, their heart, everything, even their cleaning, you're doing everything.
I think we're in a really exciting phase of expansion. Previously, we were a 35-bedded unit, which is very much the unit we're in now. More recently, we opened a further 9 beds at Westmoreland Street, where we mainly do thoracic and urological surgery. And the new exciting venture that we're undertaking is just across the road, where we're opening a dedicated haematology, oncology ITU, where there'll be 10 further beds.
My job is leading a team of around about 200 nurses. And I guess I get my buzz, my rewards out of seeing my team really happy. If we really invest in staff, then we know that they'll do the right thing by patients.
At the start of the shift, we always do a safety brief. There's a shift before that tell us about the previous 24 hours. And we briefly look into the next 24 hours, how many admissions do we have, and then we generally go to the bays.
My patient has got the tracheostomy, still in situ. He's on speaking valve, which we can...
You have 5 patients in a bay. You're looking after a specific patient yourself, but you're working as a team.
I love it because I'm not pressured to just be task-oriented. I feel like I can influence more and be of a difference to the patients' lives as well.
Patients who have had some experience in the critical care can hear the nurses talking, doctors talking, so we make sure we talk to them and let them know what we're doing, even though they are sedated.
You can have patients with a tracheostomy tube, but they're awake. So you'll have to make sure you've got your lip reading skills really on top shape, or you might have to think of ways on how to communicate.
Patients and relatives are going through like hardest days, so it's really important to have that empathy and compassion towards your patients.
You have a lot of end of life as well, so you get to grow that side of how to deal with breaking bad news and the last days of a patient.
The big thing about critical care is the team. The team makes a difficult day an okay day or a good day.
You never feel alone, and if you're not expecting this kind of situation, that's okay, because will be someone there to help you out.
He's previously had lots of multi-drug resistant bacteria, so from a stewardship perspective, I'd rather hold off starting those.
We are working interdependently with the other members of the healthcare team, with the doctors, the physios, the pharmacists, the dietitians.
Bed 2 is our long-stay gentleman
What we do for the patients, what we plan to do for them, it's an effort of the whole members of the team.
I've only been here for 2 months, and this hospital has actually put me on the BSc at London South Bank University.
We have some bedside learning, some university learning. We have study days as well.
This is for a patient that is going back on a filter.
You have got a clinical facilitators around the unit.
Prisma citrate will be this one.
They would help you then and there, and they will rectify if you're going wrong.
I feel like my growth has been really exponential in this place.
Started off as a new nurse to ITU, no ITU experience, and now I'm a senior band 6.
I was able to progress to a senior nurse, and now I'm a deputy nurse.
The shifts are really, really good because we do a set rota. I always know which weekends I'm off. If there's something going on in my social life, I can book it off as annual leave. So it just means that I have a really good work-life balance.
Critical care is not for every taste, but if you want to grow as a nurse, that's the best place for you to be. You're exposed to so many different things, pathologies, different therapies, machinery.
You need to be constantly improving as well because the profession is an evolving one.
We have a research team associated with critical care, so we have a lot of studies going on.
I've had a patient who's been on study about using medications to help manage or treat delirium, also with sedation.
But it's exciting because I've been here 6 years, so I can actually see some of the research being implemented in our daily care.
The feeling you get when you see a patient come in very, very unwell, and then you manage to be in that team that help bring that patient back to life and then see them being discharged to a ward or actually going home, that's it for me. That's what I like.